Good morning, everyone, and welcome to the August 25th Safe Income webinar. This is Deanna Mitchell with Leading Age Michigan. Today is the 533rd day since Governor Whitmer first declared a public health emergency. And we're still struggling quite a bit with it, although not in quite the same way as we did in the beginning when it hit our residential communities. So for today, we will follow our routine agenda. Dalton will start with the big topic of the day, which is, of course, President Biden's announcement on nursing home staff vaccinations. And he also has a few other updates. We will review the data on transmission as numbers continue to slowly climb in our state. And we'll finish with a few general updates and resources. So with that, I'll turn the presentation over to Dalton.
Good morning, everyone. Nice to talk to you all today. I'll be talking about kind of the big point here. So we're going to start with a brief introduction of the program, even though I know many of you probably know that there's not a lot of guidance right now. So last week, President Biden announced that all nursing home staff must be vaccinated as a condition of participation in the Medicare and Medicaid program. As I said, there's no guidance currently available, but CMS did say that they're expecting guidance to be published in September, and I linked the CMS press release here so that you have all the details available, even though there are very few. So we'll move on to discuss kind of what we're doing from the state level in terms of implementation, and then we will also look at what Leading Age or Leading Age National is doing and what their talking points are, and then also discuss a brief opportunity coming up with Leading Age National. They're hosting a town hall for Leading Age members. All right, so this slide has a lot of text, so I apologize, but we had a lot of points we wanted to make to the state to start discussions. So almost immediately upon the president's declaration of the vaccine mandate for nursing home staff, our policy team here got together and Dave wrote a letter to Director Hertel really to start the discussion and figure out what the state's plan for implementation is for this ruling, even though there are no guidance. It's a good no guidance. It's a good time to start those discussions. So what we did is we wrote this letter. You can see here, I also attached it in today's handouts with today's PowerPoint. I do have a number of links throughout my slides today, so you can access them in the PowerPoint there. We had 5 main points that we wanted to discuss with the department regarding implementation at this point. They're on the slide here, and I'll go over them very briefly. Our letter also covers them briefly, but these are kind of our concerns, our initial concerns upon hearing what's going to happen. So we want to focus around effective date. We think providers should be given some lead time before full implementation at the state level. We also wanted to know if there was a contingency plan for the safety and care of residents during necessary transitions because of workforce shortages in long-term care. We feel that this policy will create unsafe conditions for staff because of the current, or staff and residents, because of the current workforce shortage, and that transfers will be necessary to continue care. What is the scope of the plan and the state's plan here? Is the mandate strict, or is there flexibility to provide safety through other measures for unvaccinated staff so that they can still work? We feel that if vaccines are going to be mandatory, that the testing policy should be amended so that fully vaccinated staff don't have to necessarily be tested all the time, or that we can come up with a better solution now that all staff are vaccinated. And lastly, we titled the point surveyor because that was one of our main concerns, but we also feel that all state employees entering nursing homes need to also comply with the president's vaccine mandate. It would just be silly to mandate all staff be vaccinated, yet we're going to send in unvaccinated state staff to these buildings. We did make another point that wasn't one of our bullet points here, but it is something we've been asking the state for a while. And we do ask that they consider that hospitals test and vaccinate all potential nursing home discharges prior to transfer to a nursing home. We feel it is just a little, I'll say it's a little crazy that hospitals don't have to test residents or people before they're discharged to a nursing home. So we're going to move on to our federal advocacy piece. What's National's talking points? Katie Sloan, president of Leading Age, sent a letter to the head of HHS, the Domestic Policy Council, and CMS, focusing on 4 main points. I don't have that letter attached in today's handouts, but this is a link to that letter. She is looking for them that the vaccine mandate as a condition of employment be applied to all healthcare providers and settings, so that the workforce just doesn't transition to another part of long-term care, so that workforce shortages don't occur in SNFs particularly. And a sub point underneath this is that they also feel that the mandate should extend to visitors, agency staff, surveyors, quality assurance staff, essentially any other state staff or federal staff that may be coming into a nursing home. Point number 2 for them is that they couple the vaccine mandate with direct assistance to address the long-term care workforce shortage. If they're going to be mandating, they need to address the workforce shortage, because there is a possibility that this kind of compounds and worsens the workforce issues that the industry is currently facing. The third point is that they allocate the remaining PRF funds to long-term care providers. There are still some providers out there waiting for all their PRF funds to hit their books, and National feels that this is very important, as the PRF funds have really helped keep providers afloat through this. And point 4 is that the federal government increase administrative support to promote vaccine acceptance and education, and just create more resources available for long-term care providers as they're looking to educate their staffs about the importance of receiving the vaccine and kind of the benefits of receiving the vaccine. Moving from this, these points kind of tee up this upcoming virtual town hall that Leading Age National is hosting. It is on August 26th, so that's tomorrow, I believe, from 3 to 4 p.m. They're looking to gather member feedback regarding the federal vaccine mandates. While they have an advocacy campaign currently built, they're looking to incorporate more member perspective into their chats with Congress and policymakers abroad. So please do feel free to attend. The link is here, and I'll send that out. Make sure that link gets distributed out to everyone in the Safe and Calm follow-up. But they are also looking for feedback on vaccine mandates generally, and collecting data about what your current state vaccine mandates are. Just so you know, that's kind of where the conversation may be going, and you have their talking points ahead of this meeting. So we're going to shift gears here a little bit. If you read the most recent newsletter, and if you're just on top of your end dates for state programs, you'll know that the Direct Care Worker Wage Pass-Through Program is currently set to end on September 30th. Currently, the legislature and governor are working to extend the program. It's interesting. The House currently wants to do away with the program, but the Senate wants to strengthen the program with $200 million more on top of what was already allocated in the governor's budget. And right now, conversations aren't final, but it is leaning that the program will be extended for another year, and that the wage increase will be bumped up to $2.35 an hour. Now, this isn't set in stone, but this is the Senate's plan, and between the governor, Senate, and the House, the Senate is kind of the middle ground. So this is where everyone is kind of coalescing here. I will note that some senators are having discussions to expand what the definition of a direct care worker is, but those are still just conversations for now. And a lot of this has yet to be determined, as they're not going to really be hashing through the budget until after Labor Day. So just know that they are working to extend the program. It's likely to get extended in some form, and so we actually have to know before September 30th, because October 1 is the drop dead date for the budget. So we'll know in advance of the drop dead date for the program what exactly they're thinking. Slide, please. All right, so yesterday, the governor briefly discussed in a press conference some of her plans for the American Rescue Fund. She discussed, or some of the American Rescue Fund funds, I should say. She discussed roughly $2.1 billion, and if you were kind of reading the news, you'll know that it's kind of billed as $800 million for housing, which is great. I did want to highlight some parts of this plan, of her plan here, and do note that this plan she can't just go alone on. She does have to have conversations with the legislature and actually get it approved by them. So not all these will happen. I can almost guarantee that, but this is what the governor's laying out for some of the funds. She's thinking of $215 million for the Michigan Reconnect and Future for Frontliners program, $100 million for creating new affordable housing projects throughout the state. So that's roughly 2,000 new rental units, $50 million to build healthier, cleaner, energy efficient homes, $100 million to rehab vacant buildings, and $200 million to redevelop contaminated brownfield sites. I do also want to let everyone know that yesterday at a rally for SCIU in Detroit, the governor was talking about supporting a new hero pay program for not just direct care workers, but for all essential workers. They were talking about one-time lump sum payments using some of these American Rescue Plan funds. But once again, that would have to go through the legislature, and all these would have to go through the legislature. And so we don't know exactly what will come out at this time, and no one's really had a chance to respond yet because it was yesterday. So I think with that, we've covered all of the advocacy slides for today. So we're going to go ahead and address some questions. Yep. So we will take a brief moment here. And Caitlin is going to read out our questions for us today.
Yes, good morning, everybody. This question is actually for Dalton. CMS has a call this afternoon with SNF providers. Do you think they will announce some guidance today?
Well, they may. If I was going to say anything, it would be for the third dose of the vaccine, but I haven't heard anything. I don't know if you've heard anything, Deanna, about exactly what they're going to talk about yet.
I've only heard that they're going to speak to their recent announcements. This is one of their 30-minute calls, which generally tend to be very short, and they will stick to that 30-minute timeline. So I'm not expecting any really revelations today. I think that they're just going to review what they pretty much have already distributed, but we'll have to wait and see.
Great, thanks, Deanna. This next one's not really a question, it's just a comment from Randy stating that I love the point about consistent vaccination of entering state surveyors. Thanks for the comment, Randy. The next question we have is the biggest risk is outside the facility, not inside. Doctor offices, hospitals, clinics, dialysis, transportation should all be required to be vaccinated, and we should be required to test or to get proof of vaccination by visitors. Otherwise, this mandate is intellectually dishonest as a solution for keeping residents safe.
Thank you for your feedback. I definitely agree with you, and I think we tried to address that with some of our points here where we're talking about the state implementation, and federally, I think Leading Age National is working on developing those points to have with policymakers.
Great. This last question asks, is there any advocacy or other movement towards ways to increase reimbursement for CNAs and licensed HFA/AFCs? That was a great goal, but it never got adequately funded.
Yeah, so some of those conversations about the definition of a direct care worker that are happening in the Senate are about just this. They are looking into ways to reimburse providers in other settings outside of SNFs. And I know the HFA/AFC piece kind of got diminished through the requirement that the facility be serving Medicaid residents. So we are working on that goal in terms of our advocacy, and those conversations are occurring, and the senators are having them with themselves. So there is some movement there, especially with the new funding. And this new governor hero pay thing, it sounds like she wants to include all essential workers, including those outside of healthcare and these one-time lump sum payments. So we'll kind of see where this all goes by the end of it. But I do agree that it is important that we recognize the work that CINAs and licensed HFAs and AFCs are doing. All right, we got another question.
Okay, this one asks, 10 or more states have mandated vaccines for all HCWs across all sectors. Do we expect Michigan to follow suit?
So what I'm hearing is that there has actually been some pushback by the governor between her and her COVID team at the state level. She's really hesitant to make any more moves towards shutting down the state or move into any sort of mandating masks or anything. You may notice she has some hesitancy about mandating masks for schools, but Dr. Khaldun has been pushing for that rather aggressively. And publicly and privately, you can kind of see this. So I don't see Michigan moving in that direction right now. Doesn't mean we can't. But I think if the caseload does get worse and drastically worse, we may move there. But right now, I don't see that. I think that's all the questions we have for now.
Yep.
All right. So we'll go ahead and move on. Thank you. And thank you, Caitlin. We're moving on.
Okay, so we're going to take a look at the updated CDC map here that identifies by county across the US the basic level of transmission. Note that these levels are based on two measures, the total new cases per 100,000 persons and the county testing positivity rate. The percentage of positive tests, of course, is going to be related to how many persons and the type of persons who get tested. But the total new cases per 100,000 persons is a very telling indicator. And you can see that the US is now predominantly red here. And of course, that is the highest level of transmission rate there is. You can move the slide, Caitlin. So when we look closely at our Michigan map, you can see the continued drive toward red in almost all the counties. We started tracking this in July for July 8 data when the counties were almost all blue. You can see that on the far left, but now we can see that they are predominantly red. So the state data indicated this past week that there was a slow rise in cases, and the daily average of new cases is now over about 1,500 per day. Overall, across the state, the positivity rate has moved to 8.6%. That's another slight increase. And we do know that many counties are over 10% at this point. Hospitalizations also slowly increasing. There were 1,136 inpatient cases on Monday, which is an increase of 137 persons hospitalized since just last Friday. Here's our graphic, a routine graphic showing the 7-day rolling average of new cases as of Monday. It's still increasing, but you can see that during this surge compared to other surges, the incline is not as steep. It is, though, slowly growing every day. Our next slide shows our 7-day rolling average of new deaths, also slowing, increasing. But as deaths have always been a lot more variable day to day, and there definitely is not the incline that we see as with cases. And here is the CMS positivity chart. Remember that nursing facilities in each county have to pay attention to this data, since unvaccinated staff must be tested twice weekly in any red county. That's still a rule. And right now we do have an increasing number of red counties. You can see on the far right that I think it's something like 15 now, and a large proportion of our counties are now in the yellow stage as well. When we look at nursing home resident caseload, we have seen an increase since last week to a total of 53. This is about 20 more since last week. For homes for the aged, the new cases have increased to 9. And AFC cases have increased to 11. So looking at all of the MDHHS reported long-term care data, we did have a total of 73 new resident cases and 123 new staff cases in the past week. Our total long-term care cases over time, counting both residents and staff, has now just passed the 49,000 mark. CMS vaccination rates reported as of last Monday do show an increase in the percentage of residents with completed vaccinations. We've now moved to 81.33%, and that number actually moved us up a bit in the ranking state by state. But we're still only 39th compared to 53 states and territories. And staff vaccination rates have also increased a bit over the past week. We're currently at almost 53%. We're at 52.97. And that ranking has not moved. We're still kind of settled at the same spot as we have been for weeks. And our last data slide is from the CDC. And this slide we have used a couple times now. It reports the status of each county in the US based on two indicators, the vaccination rate and the number of cases per 100,000 persons. And remember that as you look at the legend grid, the red and the purple areas on the right indicate high levels of transmission, with purple meaning a high level of transmission in a county with a high vaccination rate. We note over time, as you can see all three of these graphics, we have an increasing number of counties in red and purple since we first started looking at this in late July. So let's move on now to resources and guidance. As we said earlier, there's no real new regulatory guidance out there this week, but the CDC has provided a few pertinent updates. They have published a document on the risk of contracting COVID after vaccination. The link to that webpage is at the bottom of the slide. They remind everyone that even though, and this was as of yesterday morning on their website, they remind everyone that even though the vaccines are very effective, they're not 100% protective against the virus. And they said yesterday morning that they do protect against the Delta variant as well as the other variants. These vaccines also reduce the likelihood of hospitalization and death in persons who do become infected. However, late yesterday afternoon, they also did submit reports about updated vaccine effectiveness. And apparently, there are reports saying that vaccine effectiveness against the COVID-19 infection pretty much dropped from 91% to 66%. And I don't have this data on the slide, but we will do some updates about it later. So the vaccine effectiveness dropped from 91% to 66% once the Delta variant accounted for the majority of the circulating virus. And that was a study published yesterday by the CDC. So they still see a reduction in the protection of the vaccine against the Delta variant. It's still 2/3 reduction of risk, but obviously it is falling. The CDC reminds persons that if a vaccination person does get the virus, they can transmit it to others. So persons who are vaccinated should be mindful of any symptoms that they develop and act on them if they are COVID symptoms. Also, the CDC continues to recommend that all persons, whether vaccinated or unvaccinated, who are in an area of substantial or higher transmission, and that is a lot of Michigan right now, they should be wearing masks while indoors in public places. And of course, anyone who is immunocompromised, should be taking all safety precautions and consider a third dose of the vaccine. The CDC on Monday updated its recommendations for fully vaccinated persons. And we need to remember that there are two versions of this guidance. There's one for non-healthcare settings and there's one for healthcare settings. And it seems as if when the changes for vaccinated persons in non-healthcare settings came out, some facilities and residential care communities started applying it to their settings. So we want to note here that there are very few changes for healthcare settings, including long-term care, that have come down the pike in terms of safety precautions in the last several weeks. The only real change in this updated guidance that the CDC put out Monday is that the FDA has granted full approval for the Pfizer vaccine, and we're pretty much all aware of that. But I thought it was maybe a good time to review some of these requirements since they have updated it and brought it to our attention again. And we still get a lot of questions about what the rules are. So for non-healthcare settings, persons are again reminded to wear a mask indoors if you're in an area of substantial or high transmission. And the CDC, to determine that, uses that Michigan map that is kind of orange and red, mostly at this point, that we displayed earlier. This is really important if you have risk factors or you're over the age of 65. They recommend testing after any exposures and to wear a mask indoors for 14 days following an exposure. And of course, if you have any symptoms, you should isolate immediately. For healthcare facilities, again, the rules have not changed. If you are in a county with a 10% or higher positivity rate, and your vaccination rate is less than 70%, that's just the residents in your community, you are only allowed to have compassionate care visits. And of course, compassionate care visits are the only ones allowed for anyone infected, regardless of their vaccination status. In the same guidance, the CDC continues to suggest that physical distancing and source control are best practices, even when everyone is fully vaccinated. But they do note that residents and visitors can choose to have close contact and not wear source control when everyone is vaccinated. Visitors must still wear source control at all other times that they're in the facility, unless they're in a private room and everyone is vaccinated. When anyone is not vaccinated, everyone should still maintain social distancing and masking, but a vaccinated resident can choose to have close contact with unvaccinated visitors if all are wearing well-fitted source control. And of course, for any group activity, source control and physical distancing is not required when everyone in the room is vaccinated. Work restrictions also, these have not changed. Fully vaccinated staff who have been exposed don't really need to follow any restrictions at this point. But staff who travel must still follow the CDC travel guidance. Residents, though, should be quarantined if they have come into any close contact. And we all know quarantine is no longer required for admissions when the patient is fully vaccinated and there has not been a close contact in the last 14 days. Since things are flaring up again, especially outside the state, it seemed a good idea to review the staff travel rules as well. And we know that these are quite controversial and problematic for members, but we do have to let you know that MDHHS and the CDC continue to apply them to nursing home staff. Fully vaccinated persons still have to wear source control when using public transportation. Actually, everybody does. They should, if they're vaccinated, they should consider masks in crowded settings out of state. Again, even if vaccinated. You might remember that there were a large number of persons in a Massachusetts Ocean village, I think, a recreational town, who contracted COVID during the July 4th holiday, even though the majority of them were vaccinated. So if not vaccinated, and again, this does apply to staff, persons should get tested 1 to 3 days before travel. Again, they have to wear masks on public transportation. Everyone has to do that. They should avoid crowds. They are expected to test 3 to 5 days after returning. And here's the big thing. They're supposed to quarantine for at least 7 days. And if you're around persons at increased risk, and the CDC considered nursing home residents at high risk, the rule is to quarantine for 14 days. We know that this is extremely difficult, but these are the rules as they stand right now. And finally, in this review of this guidance for healthcare settings, considering vaccination status, the requirements for PPE have not really changed, at least for not for any direct care areas. Only staff who are fully vaccinated and working in a non-direct care area are allowed to remove their masks and avoid social distancing. So let's pause for questions.
Yeah, so we have one, this isn't really a question, it's more of a statement. This states we are still required to report anyone who has ever had COVID as a COVID-related death, even if they contracted COVID April of 2020.
Yes, that's my understanding as well. I think that there's some understanding that these COVID-related death numbers are not necessarily specific to a COVID-infected person who's currently affected and dies. And I'm not sure why the CDC and the feds do that. I know, but that is the rule, as we know as well.
Thank you. Our next question asks, you mentioned requirements when talking about the CDC, but these are the only recommendations, correct? The only requirement is the current QSO, correct?
No, I would say that's not correct. These are the recommendations that link from that QSO. So when you go back and look at QSO, and I assume you're referring mostly to 20-39 nursing home, which is applicable to HFAs and AFCs as well, and assisted living actually here in Michigan, you will see that there are links to required guidance in the CDC, and this is one of them. So these are the expectations that CMS has for nursing facilities right now.
Okay, thank you. I'm not seeing any more questions at this time.
Okay, so let's move on then. So yesterday, as we already talked about, the CMS announced that they're going to have an update for nursing homes. It's scheduled for 4 p.m. today. And again, this is another of their half-hour sessions. And I'll be honest with you, I generally learn very little in the CMS half-hour sessions. They might go over a few details, but basically, we think they're just going to review the recent announcements that they've already made. They are going to talk a little bit about NHSN reporting. So that is another topic. The link to join the call is here on the slide. The Agency for Healthcare Research and Quality has made some resources available for nursing home use. These are mostly for encouraging staff to become vaccinated, but also there's a link here for all of their resources for nursing homes, and that might be useful for members. Last week, the U.S. Treasury Secretary and the Labor Secretary sent a letter to Congress stating that they don't intend to extend the expanded unemployment benefits past the September 6th expiration date. However, states can still use their American Rescue Funds to provide these expanded benefits, and Michigan has been doing that. At this point, we're not sure how much money is left in that fund or how long that will continue, but there is no federal mandate for that after September 6th. So it'll be interesting to see how this could be impactful for our staffing issues. Last week, the Journal of Health Affairs issued a preprint on the association between vaccination rates and COVID-related deaths. And they did this during using data from the first 5 months that vaccines were available, pretty much from December through April of 2021. They estimated that by early May, vaccines were able to reduce deaths by about 140,000 persons across the U.S. But these rates varied quite a bit state to state. They judge that the recommendation for vaccines they feel are the best answer to the pandemic, and that efforts should continue to vaccinate persons across the globe. Last week, the state MDHHS held a call with long-term care stakeholders on third vaccine doses. Remember, this is related to the FDA approval for giving a third dose to persons who are immunocompromised. At first, the state kind of indicated that almost all nursing home and long-term care residents might be considered immunocompromised, but they have since then significantly walked back from that concept. They put out additional guidance that they are for immunocompromised persons only, but they are willing to use a clinician's judgment on that, and they're not going to be checking on that at all. They're not going to be auditing for that clinical information. If you happen to be one of the about 30 nursing homes in Michigan who actually is enrolled as a vaccine provider, the state is encouraging you to go ahead and vaccinate any immunocompromised persons. For others, the state is partnering with some new mobile vendors to do these vaccinations. They are HONU, and I never know how to say this next one, Bones, I can't say that, and Visit Health. These entities will be contacting nursing homes, and nursing homes being the primary target right now. HFAs and AFCs will follow later. They will vaccinate people who are immunocompromised that you've identified. They will also vaccinate any eligible staff, resident, or visitor for any needed dose. But they're only going to be making this one visit. They're not going to be coming back follow-up. If boosters become approved for vaccinated persons, as the Biden administration is planning at 8 months following the last dose, the department plans to use pharmacy partners for that. So we will, I'm sure, hear more about that as the plan unfolds. So this slide is really much for anyone who wants to review the FDA emergency use authorization to provide that third dose for persons who are immunocompromised. The link is here on the page. Remember that only the mRNA vaccines, and that means Pfizer, Moderna, have been approved for this third dose at this time. The Johnson & Johnson vaccine has not. Apparently, with all of the new infections across the US, there's been a huge increase in the use of monoclonal antibodies. And the Health Resources and Services Administration under HHS has put out a video that talks about their use. It's pretty much a technical video, but if you are providing monoclonal antibodies, you might find it helpful. HRSA's goal is to ensure that the antibodies are available equitably and used as needed. They are very effective in slowing symptoms, especially for high-risk persons, and they can prevent hospitalizations, and that's really important now. There's a huge focus from the feds on this, because so many states are struggling with having enough beds for persons with infections in the hospitals. One of the topics that is new here is the use of these antibodies for post-exposure prophylaxis. So you don't necessarily just have to get COVID to receive these antibodies now. If you've had a close contact, especially if you're at high risk, you can receive the monoclonal antibodies prophylactically. Use of these antibodies in nursing home settings or outpatient, they feel can help prevent a lot of severe illness. And this video has a lot of links to resources, and the link to the video is at the bottom of the page. We also want to ensure that everyone's aware that MDHHS is holding a long-term care conference call on August 31st. They have a long list of topics that we've listed here on the slide. They will have reports from both MDHHS and Laura. And of course, we will be summarizing that call as well for members later, but this is a all provider call. Our last topic for today is a review published by CMS just this week on the impact of COVID on Medicare beneficiaries. For this review, they looked at both fee-for-service and managed care data during the pandemic, but just through the end of the 2020 calendar year. And basically, they compared transmission rates among beneficiaries between those living in nursing homes and those residing anywhere else. Basically, in terms of the Medicare population, only about 2% of them are residents in a nursing facility. However, although nursing home residents account for about 2% of all beneficiaries, they accounted for 22% of all of the COVID cases among Medicare beneficiaries. And this review by CMS was really about finding out why that is happening. They found that a nursing home resident was 14 times more likely to be diagnosed with COVID than others. But they also note that that's a little skewed because nursing home residents were also more tested than other Medicare beneficiaries in the community. So some of those numbers could be the result of increased testing. The data findings are here on the slide. Basically, during the review period, there were about 5,400 new cases per month in nursing home residents, compared to 388 for Medicare beneficiaries living elsewhere. So I think that the takeaway from this is when they looked at the data, they surmised that the location, being the congregate setting of the nursing home, was the most important factor driving the number of cases, the number of hospitalizations, and the number of deaths. They did agree that comorbidities play a factor, but they state that that does not explain all the differences in case numbers coming from nursing homes. So CMS does plan to continue to assess the factors that are associated with these outcomes, higher rates of infection and morbidity and mortality. And they plan to look at facility characteristics, quality, safety precautions, et cetera. So we can expect them to be reviewing more and more data over time. So that's all we have for today. Let's see if there's any final questions.
Yes, looks like we have two final questions. The first states, I'm not seeing in the QSO where the travel restrictions from the CDC are. Can you share where that is required?
I can show you how the QSO, I cannot do it visually here, obviously. I can send it to you. I will put it out perhaps in a COVID update later, but the QSO goes to and I can't remember the name of the page of a CDC guidance on visitation. And it reflects that the staff must follow the travel precautions. And then there's another link to the travel precautions per se. And when this first came out, and it was so controversial and so difficult, and we understand that, we contacted MDHHS to see what their take on this was, and they agreed that those travel restrictions are to be applied to nursing home staff.
Okay, thank you. There are a couple rolling in. This next one asks, are boosters approved, or are we still waiting on FDA approval for the booster?
The boosters have not been approved. And in fact, there are some experts who feel that President Biden jumped the gun there a bit. However, the FDA, hopefully, according to the Biden administration, will be approving that in September. And if that is the case, then we will move forward. But there is no FDA approval at this point.
Okay, thank you. Next, what are the travel restrictions for traveling to states outside of Michigan for fully vaccinated people?
Okay, well, I'm not sure I understand the question 100%. When you're traveling outside of the state, you have to abide by wherever you're going, the travel restrictions that may be there. So especially if you're going out of the country, there are huge numbers of travel restrictions. So you have to look at the location you're going, but I'm not sure that that's really what you're asking. I reviewed the travel restrictions, and if you want to go back a few slides, Caitlin, I can do them again very quickly. For unvaccinated persons, keep going. Okay, move forward. Okay, here. If you're not fully vaccinated, you're supposed to get tested 1 to 3 days before travel. Avoid crowds and social distancing. After travel, you're expected to test again within 3 to 5 days. You're supposed to stay home and self-quarantine for at least 7 days. If you haven't taken the test, you're supposed to stay home for 10 days. But the trick here is the avoid being around persons who are at increased risk for illness for 14 days. And we also checked with Leading Age's interpretation of that, and they believe that that is the requirement for nursing home staff, since they are nursing home people are considered an increased risk. Now, we do understand that this is extremely difficult, and I believe that there's a lot of variability about how facilities have applied this, but these are the rules as we know them.
Okay, thank you. Is there any pushback on the CMS assessment? If Walmart had the same amount of required testing, Walmart would be the hotspot. Lip service that the data is skewed, then using the same data to conclude SNFs are bad is tough to swallow.
It is, and I understand that the data is not perfect, and I think that's an understatement in many ways. I can remember days and weeks where I would put my data slides together and the numbers didn't even add up from the week before. So I've always had a little bit of a skepticism about the data, and especially if you're looking outside of the healthcare system, there is no equitable data out there. But to be honest with you, I'm not sure how they would manage all of that. I think they're having a hard time managing just the data that they have. But I agree that we really don't know to a large degree what has happened outside of the nursing home facilities. The attention obviously is there.
Okay, thank you. This next question reflects back on travel as well. The question asks, what is considered travel?
I asked the CDC that when this guidance first came out, and they really did not give me a decent answer. I actually asked, what is domestic travel? I mean, you know, so I think that we kind of landed on the idea that if you're traveling overnight anywhere, that's domestic travel. However, the CDC nor does the state have a definition for domestic travel or what travel is or how far you have to go. And so we're kind of, I guess we have to use our judgment about that. That's the best we can do.
Okay, thank you. Next question, is there any pushback from the state of Michigan on requiring nursing home staff to be vaccinated? If not, does the state have a plan for the potential loss of employees in an industry already struggling to maintain staffing levels?
Well, I haven't been in all of the conversations with the state. Dave may have been in some more than I am, but I'm not aware that they have come out at all with anything official or public about the vaccination requirements. That is the point of our advocacy letter. There are a lot of concerns that we have about the impact of this on our members and how we'll be able to possibly survive this new challenge to serving our residents moving forward. And that is the point of our letter. We want to see what the state wants to do, plans to do about these issues. But to my knowledge, I think the letter went a couple days ago, maybe, and I don't think as far as I'm aware, we have a response from the state at this point.
Okay, thank you. It looks like that was the last question.
Okay, well, if you go to the last slide, Caitlin, we always end with our email addresses. But I think pretty much everyone knows what they are. We hope that you all have a good day. We do recognize the challenges just keep coming. Even though things feel better in many ways, they just keep getting harder. We will continue to try and advocate for you as best we can. And please do remember that both Dalton and I are available, as well as other staff at Leading Age Michigan. So please email us with your comments and concerns, and we will try to address them. I hope everyone has a good day.
Thank you.
Thank you, everybody.